Globalization, the interlacing of peoples and individuals around the world for the sake of the common good. Today, people and goods are able to travel anywhere in the world at any time, whether it be for business, vacation, or relocation. In fact, around 3% of the world's population is currently living abroad. Globalization, however, also opens the door for something sinister: infectious disease. Just as people can travel across the globe, infectious disease can spread around the world in just one day, with the potential to transform into a global pandemic. Middle East Respiratory Syndrome coronavirus, or MERS, is an emergent respiratory infection that can cause severe acute respiratory illness and is closely related to severe acute respiratory syndrome, or SARS. Often mistaken for the flu, many individuals infected with MERS have gone unrecorded, but about 1/3 of confirmed cases have proven fatal. As MERS spread across the Middle East in 2013, health officials feared a global pandemic. MERS seems to be a zoonotic infection that originated in camels in Qatar, Oman, Saudi Arabia, and Egypt. It's unknown exactly how the disease is transmitted, but it is believed that MERS is nosocomial, spreading mainly through healthcare facilities. Any concerns about MERS becoming a global threat were virtually forgotten in 2014 when the Ebola epidemic in West Africa came into play. Everything changed when MERS resurged in the Republic of Korea in the spring of 2015 when a businessman returned home from the Middle East and visited many healthcare facilities for a fever and cough. As of July 29, 2015, 185 cases have been confirmed in South Korea with a total of 36 deaths. In order to contain the disease, the South Korean Ministry of Public Health and Welfare set up a quarantine system for individuals who may have come into contact with MERS for as long as the disease's 14-day incubation period. The long incubation period makes it possible for the infected to spread the disease further and even travel before ever being identified or quarantined. Because of this, there are now several countries that have reported MERS cases stemming from South Korea, including China, Malaysia, Thailand, and the Philippines. MERS is not just confined to Asia, though. To date, MERS cases have been confirmed across Europe and North Africa and have even made their way to the United States. Though the American patients fully recovered without any further spread of the disease, health officials from the Centers for Disease Control and Prevention recognize the possibility of a global MERS outbreak, and have taken many precautions to prevent this from happening by improving data collection methods and providing guidance in disease control and prevention. The World Health Organization also encourages increasing efforts to raise awareness of MERS, especially among international travelers. Without the help of epidemiologists who study the spread, cause, and transmission of disease in order to prevent and control disease outbreaks, and others who work in the field of public health, MERS could have easily become an irreversible global pandemic. As time progresses and globalization increases, epidemiology will only grow in importance and hopefully gain the funding it so desperately needs to protect mankind from emergent infectious diseases in the process. Epidemiology is and will continue to be the means by which humanity will overcome global and domestic health threats as long as these threats are not taken lightly.